Thank you, Minister, and thank you for coming in today to talk to us about this very important issue, the mental health of our nation, but particularly the mental health of our young people. And I couldn't even read the Maskey report. I deal with children all of the time that are fighting for mental health supports, and to think that the state once again has let down those 46 children that we know of, there could be more, is absolutely scandalous in 2022. There's not an area, there's not a town, there's not a village, a parish that hasn't been touched by mental health in this country. Very often it's left to local leaders and local individuals to try and scramble to try and heal the town and heal what's going on. And we don't have the answers. Social workers don't have the answers. Very often you're nearly left counselling the social workers yourself to try and give them strength to carry on. So they too need supports. Those social workers, those people that are working in mental health services, they need to be minded, because they're the people that are going to be leaving, and we need to find people to replace them. So the area of mental health is one requiring urgent attention. No one in Ireland is untouched by it, either in themselves, a family member, a friend, and the impact on communities as a whole is keenly felt. The estimated prevalence of mental health disorders is relatively high in Ireland compared to other European countries, yet spending on mental health is relatively low, according to the OECD figures in 2018. In 2021, Ireland's mental health budget was €1 billion, or 5% of our overall health budget, compared to 12% in New Zealand and the UK. The Mental Health Commission reported in 2019 how the level of change in our mental health service provision is uncoordinated, ad hoc and slow. Issues highlighted include the need for best practice to be applied consistently across the country, for specialist inpatient approved centres to be up to standard, and the need to continue moving the treatment and recovery model to specialised professional community care. There is currently a deficit of about 100 permanent consultants in mental health services, the professional body of psychiatrists has said. According to the HSE Medical Workforce Planning for the Specialty of Psychiatry, published in March 2021, there are 526 consultants delivering psychiatric care in the public healthcare system, with an additional 55 consultants working exclusively in private mental health care. An estimated 276 consultants are projected to leave the publicly funded workforce over the next 10 years due to retirement. The review found some 825 consultants will be required by 2030 to meet demand. Where are these psychiatrists going to come from? If they're here in Ireland, what do we need to do to get them into the job? If they're not, and we need to recruit them from abroad, how do we get them into the country and working? We need answers to these questions. I've been advocating for, I'd say, 10, 15 years, and now that I'm here in this place, we need a dedicated counsellor in every single school in this country, primary and secondary. Our children are our future, and they need us. None of us in this chamber know what it's like to grow up as a child in Ireland today. Our children do, and they need someone to talk to about that, someone who will help and guide them. And a 1 year or a 2 year waiting list doesn't really cut it. Teachers are the first people that will be able to tell if something is wrong with a child and something isn't right. Having a counsellor in-house in the school that child can go and relay those fears to is really, really important. If they're looking to go to CAMHS, it could be 18 months before they're appointed. So having school counsellors is really, really important. We need community crisis groups, trained teams who will move into towns or communities which have experienced a suicide or is having a mental health epidemic, and offer concentrated and dedicated support to anyone who needs it. So like in my town, we had 5 in the space of 1 year. In my home parish at home, they have 4 in 1 year. they're grappling to try and find solutions. So we need some sort of an NGO that is funded to get into those towns, do a health check there, find out what it is they need, and give that town or that parish the best supports they can. We need to do more when it comes to online safety for our children. They need to be taught in an age-appropriate manner about the dangers of the internet, social media, how to engage in good online behaviour and things to avoid doing online. We need to build resilience in our young people. We need to give them scope, have them understand their place in the world, its history, how strong they really are, and empower them to take control in their lives, that school and social media aren't the world, and there's so much richness and fullness of life out there just waiting to experience. We just need to give them hope. And having confidence and resilient classes available to our youth in our communities is really important. So maybe having money available to our youth clubs for confidence and resilience building in our youth is very important. Children in care are probably the most precious because they're the ones that haven't experienced love from day one. And looking after them, and I have to say the care system have been very, very good when it comes to getting a child into CAMHS. You don't have to wait very, very long to get into CAMHS. You're really in there quite quickly and quite swiftly. But, you know, sometimes the auxiliary forces, the counselling that they may need is not there on tap, and they're very often just given pills, maybe just to medicate the issue that they're dealing with, putting a plaster on it, as I call, temporarily, to get over that bump. That is never the long-term solution. And any parent or anybody that's in childcare knows that giving a pill to a child doesn't fix the problem. It's all about talking and counselling. When it comes to children in aftercare, if they're not in aftercare after the age of 18, if they're not in aftercare, everything stops. Everything stops. If they're not in education, or everything stops. Their access to mental health supports is completely gone. You really need to put that up to about 26, 27 years of age. Those children, they'll continue to have mental health problems throughout their entire life if they're not given those supports after the age of 18. Sorry, Chair, I'll finish up on that. Thank you.